It's really a pleasure and honor for me to have the opportunity to present to you our projects that involve the use of microgravity expanded stem cells in regenerative medicine, specifically to treat stroke. I must tell you a little bit of a story. My role, I'm the medical director for our cell therapy. So most of the studies that involve stem cell or any cells to go into patient come through me. So over time, I kind of become the stem cell guy. And it's one of those water cooler talk. I met the chair of neurology. So my background, again, is transfusion medicine. I'm not an expert in stroke, but I met a neurologist, a good friend of mine. He said, "Oh, how are your stem cells doing?" I said, "They're doing fine. You know what? People are using it for stroke as well." He said, "Oh, really? Well, we should study stroke, but I think we should study hemorrhagic stroke." Now, some of you may know there are two types of stroke, ischemic stroke and hemorrhagic stroke. And most of the studies out there is really looking at ischemic stroke. Ischemic stroke is usually caused by an emboli to the brain. Hemorrhagic stroke, it tends to be associated with high blood pressure, and it's a rupture of vessel in the head. As you know, stroke is very fatal depending on when and how it occurs, but specifically hemorrhagic stroke is much more fatal relative to ischemic. And if you survive it, you do well, but if you don't, you either die or have a severe consequence. So that really excites me. But to tell you the truth, inherently it excites me more because that's what killed my mom. And I've been wanting to do something about it, knowing that other people should not lose their mothers prematurely because it's still painful. So that you can see in everything we do, there is a story and there is something that gives an energy to it. Well, the disclosures, luckily this meeting didn't say we need to say disclosures, but maybe you can read through it. Thank you. So we decided, so having said that, I know that mesenchymal stem cells are quite unique compared to other types of stem cells. Why? Because they secrete factors that stimulate differentiation. They have been shown to themselves differentiate into neurons and other tissues. But in addition, they are shown to be anti-inflammatory. And those of you that know a little bit about stroke, when you have a stroke, a couple of things happens. Of course, there would be ischemia because the blood vessel that is supplying the area in the brain is blocked or ruptured. Of course, there would be lack of nutrient because the blood doesn't get there. But very critical is inflammation. Actually, what we do medically when stroke happens is mainly controlling those symptoms of the disease. But there is very little. We don't have anything to offer to induce regeneration or cause repair. So MSC really kind of designed a stem cell for this kind of situation where it has the ability to induce regeneration as well as inflammation. Well, if you're intending to embark into this project, the first question you ask is, does it really work, especially in our own hands? So the first thing we did, we set up an in vitro studies. This study involved mimicking the condition of stroke, that is hypoxia or ischemia, and then deprivation of glucose. And it involves using this modular chamber that you can flush out the oxygen in and replace the air in it with nitrogen and 95% nitrogen and 5% CO2. So in a way, you are inducing a hypoxic condition. You also use glucose-free media. So that induces a lot of stress. So we use a cell line called N17. It's a neuroblastoma cell line, but they are neurons. So basically, we have a setup. I need to figure out the green button. Or, Anyway, to your right, we set up the neurons in this well, and then after the stress, we put in the MSC in an insert and replace the media, use growth media that has glucose and growth factor that would support function of MSC as well as the survival of the cells. So, and then we looked at the effect of the stress and then the co-culture of the MSC over time, so day 1 through day 5. So obviously, we want to see what is the effect of the MSC on the proliferation of the neurons, the M17 neurons. And this is our control, the rate of growth of just the M17 cells without any stress. And this is the M17 with the oxygen glucose deprivation. So you can see that they really don't grow as well. But when you add, sorry, this is the OGD stress. And then when you add the MSC to the well, you can see there's improvement in the cell proliferation. So basically, the MSC is secreting factors that is enhancing recovery and proliferation of the M17 cells. We look at cell viability the same way. Look, you can see control. This is the cells without any stress, and then the cells with stress, you can see the viability is significantly low. And then when you add MSC, you see improvement in viability. The same thing with apoptosis, programmed cell death. You can see with oxygen glucose deprivation, the apoptosis rate is much higher compared to control. And when you add the MSC, you can see improvement even better than the control to some level. So clearly, these MSCs are working. But the question, how do they work? We don't know. So we embark on finding what are these factors that the MSC actually secrete to function. And to cut the story short, we look at tons of factors. And, but what seems to work here is the interleukin 6. And IL6 is very interesting cytokine. You can read a lot more about it. It has multiple functions, and it's one of those cytokines that has effect on everything you can think of. But in any way, we look at expression of IL6 in the conditioned media after culture with the M17, and then after the stress, you can see IL6 is not secreted. But, and then we look at MSC alone, and also we see the MSC actually secrete IL6. But when you combine the MSC with stress M17 cells, you can see that the amount of IL6 increase. So if you look at the changes over time, you can see the level of IL6 goes up. And very important to prove that IL6 actually play a role. So this is our control group that has nothing, no stress, no MSC, no anti-IL6 antibody. And here we have stress, meaning, so you can see the proliferation of the neurons is significantly reduced. And when you add MSC, we see the effect of the MSC inducing recovery, so you can see improvement. And then when you add anti-IL6 antibody, that effect is blocked. So that means IL6 is important. Another factor that is important is VEGF. And some of you know that VEGF, and we hear from the previous speaker that VEGF is quite important in angiogenesis. And so we look at the same way, we look at expression over time, where we see increase after stress. And then the same way we stretch the cells and we add MSC, we see increase, MSC alone, and then we see an increase when you combine stress M17 cells and MSC. So clearly, when you block that, and again, in interest of time, you can see that when you block the effect of the MSC, goes down. So when you have stress M17 with MSC, with anti-VEGF, you don't see the effect. So we think IL6 is important. We think VEGF is important as well. The other thing also, we look at markers of inflammation. TNF-alpha is a Th1 type cytokine that plays a role in cellular immunity and inflammation. And the same way, adding MSC actually reduces the TNF-alpha. Now, the other thing is, while we see this in vitro, what happened in vivo? So we use a model for stroke. And to cut the story short, because of time, we use autologous blood from the rat and then inject it into a specific location in the brain to induce, to mimic the stroke condition. And then we treat the mice with this is showing that we actually induce the stroke. So we induce the stroke and then treat the mice with MSC and then monitor them using behavior tests. Every other day until day 7, we take blood sample and continue on day 14, 21, and 28. So I want you to draw your attention to the rats in the chambers. This is our control group where only media was injected. And then this is our treated rat with 1 million MSC per kilogram. And you can see the treated mice are using both limbs, while the untreated mice are only using one limb. So clearly, and then there is a way to quantify this. It's not that easy. Pang is in the audience. He can tell you, observing this rat and seeing how they use their limb is not that fun, because sometimes they get lazy. They just stay still. But in any way, this is the control group where there is no stroke, and you can see they're using their limbs together. So the percent these are the stroke patient without treatment. So you can see the asymmetry is high, so meaning they're using one limb. And then when they are treated with 1 million MSC, you can see the percent of asymmetry is much less, so meaning they are using both limbs more. And then with 5, also you see some improvement, but this is the surprise, that with less MSC, you actually see better physiological effect, better function. And apparently we're not the only one observing this. So those of you that are interested in doing this type of studies or cell therapy in general, the idea of giving more cells doesn't necessarily correlate with good outcome. So now we're thinking of going to the clinic, but the main problem is scalability. There's a lot of talk about the difficulties of expanding stem cell, MSC specifically, to have enough cells to do clinical studies. But since there is no real good method to expand cells, it takes time, so we ask whether microgravity can help us. And from what you hear previously, and there are other studies in simulated microgravity environment, that actually you can produce a lot more cells because the cells tend to grow better in microgravity environment. So luckily Cases provided this funding, and again our objective really is to produce clinical grade stem cell that can be used in patients. So the first thing that, this is step 1, we want to do a proof of principles that actually do stem cell proliferate in microgravity environment. And then we're going to compare it with cells that are concurrently run on Earth and see the difference. We also want to see the nature of growth, their morphology, their growth characteristic in space. And then we would like to look at the genes expression profile, and how that is different from the genes that are expressed in cells grown on Earth. And then we will look at the possibility of using these cells in vivo. At this stage, we want to try it in animal models, just the same way that I showed you. So basically, we are looking for safety. We're looking for whether they are as effective as the cells that are grown on us, or compared to the studies that we have already done. Now, we also partnered with Biocell, as Mary's, if I can have 2 minutes, I know my time is up. As Mary mentioned, Biocell had this cell bioreactor called Biocell, and we're currently characterizing it to see whether we can grow the cells. They have 2 types of cassettes. One can support only adherent cells that bind to one side, or another cassette that can support growth of cells on either side. But as you can see, we're trying to optimize this cassette on Earth, and we kind of struggling, well, how would this happen in microgravity? So currently we're trying to use simulated microgravity to evaluate seeding density, to evaluate cell characteristics, so that we can prepare for the flight hopefully next year. Now, I'm relatively new in space studies, and I was amazed by a lot of things that we take for granted that happens in our lab. Simple things like, changing media is a challenge. And the first thing is, whatever you do, you have to think of the crew time. I wish I can go. Then I can spend the whole of my time. And I was amazed that each astronaut have about 20, 30 projects to. So their time is really very limited. So, and nobody tell us, oh, what you want to do is not possible. They just say, okay, tell us what you want to do, but they will prioritize you. If your project is full of crew time, you go to the bottom. So if you want to go, you have to improve streamline your process. You know all about launch delays. I mean, the Orion was postponed for a day, but sometimes it can be for a month. So if you set up your experiment, as you know, it's very challenging when you get postponement, because then you have to go back. So currently we're trying to figure out how do we do that without having too much impact in case there is flight delay. The other thing is payload. There is limited space for the cassettes that you allowed to carry, reagents. The more cassettes you have, the more media you would have. You have to think about the samples also, so that needs to come back. Then the issue of storage. How do you store the samples, either during transportation and at International Space Station, and how they come back? So that also is a challenge. And then the need to bring back as many viable cells as possible, because we want to do in vivo studies, we want to do a lot of cell characterization. Then we also need to observe the cells at the ISS, and so we're trying to figure out how feasible that is. I must thank Pang Huang. He's in the audience. Most of the animal studies done by him. And Athena Russell does all the preliminary characteristics. We have a lot of data and we learn a lot, but because of time, we couldn't be able to share that with you. I'm also part of a group that space enthusiasts, Larry Harvey, Bob Twigg, some of you know them, and they are quite involved in space, and they're kind of guiding me because I'm relatively new in space research. But it's very exciting, and I'm happy to answer any questions. Thank you.